pledge allegiance to the flag of the
This
United
conference
States
will now be recorded.
and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Sorry about that. I had pressed the button already, but
Sorry.
it's always a delay
Takes a
before.
delay, doesn't it?
Yeah.
Okay, we're here for a meeting.
What do you need? This? Oh.
I didn't bring it up here with me. 9 a.m. was disaster resolution. Is that Randy Frank gonna be on there for that, or anything? Just-
He is on if you need to ask him anything.
Randy, you on there?
Yes, I am.
Okay, can you give us any feedback of what you need, what exactly, how long you think this is for, or anything?
Yes, sir. What this is, that we're renewing our declaration because it expires on a Saturday. This keeps us in the loop. We continue to receive supplies and services. At the very end of it, the language in it should say until rescinded, so there's not a shut-off date on this particular declaration.
Okay.
So it'll go until the governor turns it off, or unless you decide to turn it off later.
Any one of us, governor, can turn it off, or we can too?
That's correct. You can stop whenever you want. Once the county decides to opt out on the declaration, it adds the liability on the county for anything that would happen to the responders.
Okay. Any commission have any questions?
Oh, this is just an extension of what we've been under presently, correct, Randy?
That's correct. The one we're currently on ends on Saturday.
So when we enacted that, we did put an end date to it?
Yes, you did. You gave it 60 days.
Okay.
Okay.
And
Jonah?
then this one is written until rescinded.
Okay. Jonah, you got anything?
No, I'm ready to go ahead and make a motion to approve the disaster resolution 2020-23.
Okay. Have a motion by Jonah, second by me. All those in favor, say aye. Aye.
Aye.
Jonah? Aye. Okay, 5-0.
Thank you.
Yeah.
Yep, there's one here. Can we use your stamp, Jonah?
Yes, sir.
Alrighty. Here in a few minutes, we're supposed to go into Board of Public Health. We'll. Oh, yeah. Yeah. We'll go into Board of Public Health. Is Deidre gonna be on at that time then?
She is on.
She's on now, okay. Morning, Deidre.
Good morning.
And Commissioner Gehring had asked that this be added.
Okay.
Yes, I called Chairman Gehring last night and asked him if this could be added. I guess we've all seen what's transpiring in the county right now with the number of cases that we have going on, and I think all of us have been hearing from constituents, either for or against, a lot of constituents. I took it on myself to speak to a few people that I respect quite highly in regards to this matter, and one being from another county in Kansas, how they were, because I knew that they had a mask regulation, but their commission just opted to follow the governor's mandate rather than doing their own. So I spoke at length with him, and you know, I'm kind of anguished about this. I've prayed about it a lot, but I think in order to get our kids back in school, to keep businesses open, whether I agree with the use of a mask or whether I don't, right now I feel like maybe it's time to look at a mask mandate.
Any further? Snake?
No.
Okay.
Now, I've been receiving the same comments. All my comments have been for wearing masks. I have no negative. Here's
Okay.
And so,
I would suggest maybe we do it for 6 weeks.
Okay.
Well, here's the motion that I would make if you want to listen to it. Okay, go ahead.
I'm wanting to have a discussion before
Sure.
we have a motion or even hear a motion right now, the way I would like to do it.
Okay.
Diane?
of course, I'm gonna disagree, and I have heard, I'm knocking doors every day, all day. And the majority of the people in my district are opposed to a mandate on masks. They all recognize personal responsibility. They all recognize that there are a time and a place. They all recognize that they're willing to do it at certain times in certain places, but not a mandate. That it is really not. I just agree with I'm gonna speak for my district and my people, and actually all of Marion County, because it is a personal responsibility. And we have a lot of smart people in our county. They know the risk here. They know the severity of it. And on the second hand, they also know they have to survive. They have to live. They have to go about their lives. And I'm totally opposed to a mandate of any kind. I'm not going to mandate, tell anybody what they have to wear. I ask for personal responsibility. When you go into a public place where you cannot social distance, I think a mask is probably appropriate. I am wearing a mask when I knock on doors as I'm campaigning, because I don't know what's on the other side of the door. And I think that's appropriate. But I don't want to be told that I have to wear a mask everywhere I go. And that somebody can call up and say I'm not wearing a mask. I think that's off the charts, and I don't think it's necessary. And I would also ask, how many deaths have we had here? Is it still just the one?
Deidre, I'm going to refer to you.
Yes,
Just one death.
Okay.
Yes.
So the people are actually catching the COVID and then becoming well after treatment, am I correct?
that we currently, out of the 42 total cases, we have 11 active cases.
Okay.
Yeah, they do tend to recover, but the recovery is not always easy.
I don't think any illness is easy to recover. So I'm still gonna stand. I'm not gonna waver. I just believe in personal freedom and personal rights.
Okay. Deidre, I'm going to say a few things that I feel that needs to happen for us as commissioners. We're supposed to have facts and things to make decisions on, and just the idea of 42 in the county, that's not, in our population of 12,000, that's not a lot. But what I'm saying is, we know no more than what you say right here in the meetings. We don't know whether it's 42 in one corner of the county, the other corner of the county, or anything about this. And so I'm just under the impression, for me to make a good decision, I don't need names. I don't need that. I just need to know locations of how many roughly in the area or something. I mean, I need more to make a good decision on this, except for like what Kent referred to. Our schools is one of our most important things right now to get our children back in school. So, is there any more that you can give us, or are you still going to stick to HIPAA and say that there's just no more information? Because other counties says there's nursing homes and different things happening. I'm just asking you, what can you give us for information that's not violating someone's personal rights?
Well, I will tell you, we've had cases from one end of the county to the other. So it is in almost every community. It's kind of, we've got an age spread there, and you can tell that on, KDHE's map, like I showed you on Monday.
Okay.
It seems to be family units now. But they are throughout Marion County. They aren't all in the northern half. They all aren't in the southern half.
Okay.
They are throughout the county. There's probably cases in, and just looking at your districts, they're in all of your districts.
Okay. Okay. Well, that's a little more than community spread. I don't know what the qualifications for community spread is, but that's what we was notified yesterday on a text, is community spread. So is that what you're saying?
Community spread is where we have several cases that we have not yet determined where they were exposed.
Okay.
It does take a little bit longer to determine, until we ask the people to let us know where all they've been within 14 days. Sometimes if it's in, like a workplace or a facility or something, something like that, then it takes a little bit longer for another case to show up, and then we can say, oh yeah, they got it at that place.
Okay.
So,
well, that's.
but I feel like right now it is time, and I do want to clarify a little bit about, I don't know if anybody has had a chance to look at Sedgwick County, Dr. Menzies' his update or his order, but when you do a mask mandate, there are exceptions. That doesn't mean that every time you step outside of your house, you have a mask on. So I think we have a lot of misinformation out there, and I would like for you to I would be very willing to help you write a mask mandate, and there are exceptions, like individuals, and we could specify that. Again, I'd like for you to take a look at Sedgwick County's, because it's beautifully written, and it simply says individuals wear masks indoor and outdoor in public spaces where distancing of 6 feet is not possible, in line waiting to enter public space, obtaining services from the healthcare, including but not all limited to hospital, pharmacy, medical clinic, library, laboratory, physician or dental office, veterinary clinic, blood bank, unless otherwise directed by an employee or a healthcare provider. Waiting for riding, public transportation, we don't have a lot of that, so we might not want to put that in. But if you, job share, like if you carpool to a job, it does, you should wear a mask. And then it has a section that covers businesses and organizations where employees who are working in space visited by customers or members of the public, regardless of whether anyone from the public is present at the time, employees who are working in a space where food is prepared or packaged for sale or distribution, customers, members, visitors, or members of the public are in a facility managed by a business or organization, or employees who are in a room or enclosed area where they can't be 6 feet, you know, apart. And then there are the other exemptions, such as persons under 5. Now that's what Dr. Mintz recommended. I see that their commission actually went to 11 as the age group. So the commission did amend Dr. Mintz's order. They also, you know, this might be the time if you're thinking about limiting gathering sizes, or, you know, we don't have, I would strongly recommend if we had bars, that those, you know, have, if they sell food, fine. Otherwise, that we haven't had that spread in Marion County. I don't believe we have that many bars, but I will tell you, around the state of Kansas, I'm sure you've all heard, a lot of the cases have, the bars have had the clusters.
Okay, I'm gonna stop you there and turn it over to Jonah, because he didn't give his opinion yet, and see if he's got anything. And then, Jonah, I guess, anything else you want to say, or before, you know, I don't know what the commission wants to do, whether they want to accept that, but Kent's got one, whether we need to look at this and bring 2 or 3 for Monday morning, or what we need to do if the commission's ready. So go ahead, Jonah.
Okay, I'm just gonna, I struggle with the mandate period. It goes against me, my core. I'm up here in Colorado. I'm wearing a mask everywhere I go. Everybody, you know, everybody's got them on, and hear on the news every day on how the numbers are still rising. And I hear about the 911 calls that come in that because somebody's not wearing a mask. And I don't know. I mean, we're gonna get inundated with a bunch of these calls thinking that somebody's breaking rules, and our law enforcement's just gonna be overrun. I don't know. That's what I got.
Okay. Kent, I guess unless the commission has anything, I guess we could listen to this, or?
Well, you know, at this point, you know, Deidre's given a ton of specifics.
Yeah.
And if we do look at one, I guess we need to look at what her proposal would be. But at this point, if I remained in favor of it, I would want it to exclude children under the age of 11, health conditions, and also exclude churches. I believe the leadership of the churches can determine how to carry on their services, and that's their right to do so. My main concern is getting our kids back in school and keeping our businesses open.
Okay.
So at this point, I guess I would revert back to Deidre to supply us what would be an appropriate mandate to look at, if we're going to look at it, because there's a lot of different areas there, you know. And if we give a generic, if I'd make a generic motion,
You don't do that.
it's not gonna, people aren't gonna understand it.
Okay.
Unless they've got the whole thing there.
Tina, I'm just gonna ask you, you don't have any mandates or forms or anything so far that you have in your hands or anything?
No, I have not researched that.
Okay.
I can tell you this, I talked to a county administrator the other day that does have a mandate, and I said, what is your biggest issue? And he said, well, we're not enforcing anything, but it is tying up our lines, because we've got people calling in saying somebody's walking down the street with not a mask on, or somebody just walked into the hamburger joint without, and he said, we're getting those calls at the county level. And there is no enforcement, people. I mean, that part is personal responsibility. We are not gonna put our sheriffs out on the street and say, go mandate it, you're gonna enforce this now. It's impossible, and that's not what we're here for. That is an infringement on people's rights.
Would I get the feeling from the commission then that we needed something presented in front of us Monday if it's, Diane, I mean, I understand your side of you too, but I'm saying if there's anything, I don't want to vote on a generic.
No,
right now.
I don't think it would do any good, because
So,
Deidre got very specific there.
yeah,
And if we don't pass something that's fairly specific,
yeah. And then how much enforcement are we gonna do behind that if something's passed?
I don't see any enforcement.
Okay.
My vote would be
Well-
without enforcement.
I will tell you that when we did have those orders out there, when the governor, back in the day when we followed the governor's orders, we received many, many phone calls. And I think that if we do any type of mandate, we're always going to receive those phone calls, and people are going to, call out those who are not following the rules. But I guess that's something that we had to deal with. But it's, if it's well written and you all can agree on that, I think that's something that we owe to the public.
Okay. I personally, unless there's more conversation, I'm willing to let you present something to us. Maybe if you can get it to us in our packet so we can sit down and read it and understand it for Monday, why. And unless there's more conversation here, I'll open the floor.
Is that possible in that time frame, Deidre?
I will try. I probably won't get to it till later this afternoon today.
I guess, to me, you could send us out an email. It wouldn't have to, necessarily be part
Yeah.
of the packet.
No.
Just
Yeah.
something.
I will try and get it to you at least Saturday.
That'd be good with me, to at least look at it so we know what. Yeah,
So I
Diane?
just have a question. I agree with Ken on the churches. I agree on churches, but then I have this problem with how can you possibly exempt churches and not businesses? I mean, what's your criteria to differ? Because that's large gatherings in some cases. So how are you defining?
Well, I
The
think
difference.
constitutionally, the church has a right to assemble.
I think constitutionally, people have the right to assemble.
Well,
Well,
correct.
I think, I will be honest with you, I've gotten numerous emails about people that are pro-mask, and probably 75% of those emails have come from faith-based organizations, and they could be treated like, I think it was Ken said, businesses, in a sense that if they can't social distance the 6 feet, then they wear masks. And again, the emails that I've got, they were very pro-mask, and I think a lot of churches are suggesting that. And if the county mandates it, it's like if we say an individual should wear a mask whenever they're in a public place and they can't be social distance, that would count. So basically it is not necessarily the church's responsibility, it's the individual's responsibility.
And so, Deidre, I would want to just question one other question. And when you say wear a mask in places where you can't social distance, I will say, I happen to know that if I go into the grocery store right here in Marion, I can social distance. I don't have to get within 6 feet of anybody else. I can go down a different row or a different aisle. Same way with the hardware store, the auto parts store, whatever. Whatever business I go into as a responsible person, I can always social distance. You don't have to get close to
Okay.
people, period. You just don't have to. And if there's a big mad rush of bunch of people, I can turn around and walk out of the business. So I question that too. So that to me would eliminate a lot of what mask wearing for those who don't want to, because if I'm in the grocery store down this aisle, I can certainly, I can go a different direction. I can social distance, any responsible person can.
And I think that's where it gets into if you have to wait in line or when you're at the checkout counter, you know, and it's common sense too. If there's no one in the store but you, then that's a lot different than you get in, you get out. I mean, but also I think that if people get in the habit of wearing masks, it's just like grabbing your sunglasses or grabbing your wallet, your purse to go to the store. That's just part of your dress.
Kind of not
Yeah,
so
I don't
much.
like to always wear them either, but I always tell myself, think of those healthcare workers that have them on 12 hours a day.
No, and that's a profession that they chose, and they're in a specific setting to where that's something they knew about from day one.
Correct.
Can I jump in here? As far as the must go, I think getting something put together for Monday so we can review it would probably be best. I have a few other things on the health side of things, and it involves other healthcare professionals, and you know, they're bound by HIPAA, and some of the information on their patients isn't being shared to them, and they're accidentally, or however you want to say it, are coming in contact with those patients when those patients expected the healthcare professional to already know. Is there anything we can do to address that, change that up a bit? Because we're potentially putting our healthcare providers at risk by not informing them of their clientele when they have to take extra precaution, I guess.
So if you're referring to the situation in the paper, we don't typically, we work with the healthcare provider that did the test. And when we place individuals in quarantine, we don't ask, and KDHE does not recommend that we ask who their healthcare provider is. There may be 25 people that we place in quarantine because they were in contact of a person. People don't want to give us a lot of information, and that's just not something. If we were to ask every 25 people who their healthcare provider was, and then call 25 healthcare providers, the healthcare providers aren't going to want to get all those calls. I think it's the individual who is placed in quarantine. It is their responsibility, and we tell them that if they are placed in quarantine and they have symptoms, they need to contact their healthcare provider and let them know that they have been exposed and are in quarantine. So that is that patient's responsibility to let their healthcare provider know. Does that answer the question?
Yeah, it does. It just, I just feel like we could be doing a lot more to help people through this. And it seems like they feel like they're getting rolled over on. And I just don't know how we can change up how we're doing something to just not feel so secretive.
Deidre?
Yes.
I understand adjacent county on their, when they release information, they also list whether the positive test was symptomatic or asymptomatic. They also list whether it was travel related. And I didn't get all of it. Another person told me that they also list what quadrant of the county the test came from. Are those items that are they pertinent, or would they be helpful to the community?
I think once we get more cases, we can do that, because then it's not so easily identifiable. The one case that was in the paper, if we would have identified the age, I think that would have been pretty identifiable, because we don't have too many people that age. But now as we get more cases, also the thing, I'll just be flat out honest, the staffing that we have here right now, we're working on that. We're getting a couple of other nurses on board, and we also have to purchase a program that allows us to do that. So we plan to do a dashboard, and if we can get enough staff to put those statistics together. Right now, the staff, the contacts, and I know it doesn't seem like a lot, but it's not, we make one phone call and we get all the information we need. It's sometimes we go back and forth with phone calls before we get the information. So I would be willing to, if any of you want to come take a look at the actual process. I can't show you the system. I mean, I can black out names and do all kinds of things, but it's not quite as easy as what it sounds, but we're working on it.
I had one other question just quickly. There's an issue with hand sanitizers. Evidently, there's a bunch of hand sanitizers out on the market that contain wood alcohol that is very dangerous. Do you get a list of those?
Yes.
Is there a way that we could put a link to the health department with that, or put it on your Facebook page? I think that information, you see it, but it's not. I think they're still adding even more.
Marcy did that.
But, and maybe even hard copies of that type of thing for the senior centers where, a lot of the citizens maybe don't have internet access, where they at least have access to a hard copy of, don't buy this because it's dangerous to your health.
Yeah. I think Marcy deals with that, because Randy and Marcy are where the resources.
Okay, well, I just think that information needs to be out in public, so, because
Okay.
that could be worse than getting COVID.
Well, and I think businesses need to and individuals, because now is a prime time for people to sell their product, and it may not always be what it's set out to be.
Okay, does anybody else have any more concerns? I mean, outside of the masks? I mean, I think we've addressed the masks enough to know that we're going to get something on Monday. Is there any other COVID-related items? Okay, well then I will make a motion to adjourn.
Second.
Got a second by Ken. Any other discussion? All those in favor?
All right.
Aye.
Aye. 4-0.